is synonymous with playing, jumping, running, and so many mischievous activities. And what's more, alongside all of these comes falls and injuries. What should you be doing when your child falls and has some kind of injury? I, Dr. Supriya Patil Ganeshwade, would like to discuss today the first aid for oral injuries in kids. First and foremost, be it any kind of injury, parents must not panic. Children look upon their parents as pillars of strength, and especially during such events when a child falls, they look upon to you as for physical and emotional strength. Seeing their parents panic will add immense and additional stress over them. So being calm and composed during such times will help them relieve their stress and pain. So let's take a look one by one at the different kind of injuries and what first aid should be followed. Gum injury. If the gum is injured and if there is bleeding from the gums, apply a clean, wet gauze or handkerchief or any kind of cloth over the affected area to stop the bleeding. Wrap ice in a cloth and apply it from outside. Contact your dentist immediately. If the tooth is chipped or broken, ensure that no pieces of the tooth are embedded into the lips, the tongue or the cheek. Apply pressure if the area is bleeding. Use a wet, clean gauze and hold it over the bleeding area for almost 10 minutes or until the bleeding stops. If possible, try to find out the broken pieces because sometimes the broken pieces can be refragmented over the tooth. So for that, keep the broken pieces moist in a cup of milk or the child's own saliva and contact your dentist immediately. Apply ice over the affected area from outside to reduce the swelling. The next kind of injury is where the permanent tooth is completely knocked out or completely out, fallen out. In such a case, find the tooth if possible and hold it by the crown. We have a crown that is visible in our mouth. This is the crown. And we have a root which is embedded inside the bones and covered by the gums, which we cannot see. So never hold the tooth by the root. Hold it by the crown. So when a tooth falls off, take it and hold it by the crown. If it is dirty, wash it, rinse it in cold water for say 10 seconds. Do not scrub or use soap. Absolutely do not scrub or use soap. Just rinse it with cold water for 10 seconds. Place the tooth inside the socket and ask the child to bite over it gently. You can place a clean cloth or a gauze and ask the child to bite over it. If you are unable to place the tooth inside the socket, then store it in a cup of milk or the child's own saliva, but do not store it in tap water. Take in a cup, take some milk or ask the child to spit into the cup and place the tooth inside the cup, completely embedded in the milk or the child's saliva. Contact your dentist immediately. If you visit the dentist say within 30 minutes and if the tooth is re-embedded or re-implanted into the socket or put back into the socket, then the survival rate of such a tooth is around 90%. That is, you can save the child's permanent natural tooth. However, if you delay going by say 2 hours, the survival rate drastically drops down to only 5%. So visit your dentist immediately within 30 minutes to save your child's natural tooth. These were the different kinds of injuries and the first aid to be taken. We cannot stop our children from running and playing around. the least we can do is be prepared if such mishaps happen. Thank you.